Intervention Presentation and Capstone Video Reflection. Good morning. My name is Alice Hill, and this is my intervention presentation and capstone video reflection. The intervention for my project was focused on obesity in adolescents and childhood obesity. Obesity articulates to the excess accumulation of fats in the body and has the potential to impact the individual's health. This condition has worsened over the 5 decades. Of note, it is a sophisticated situation that interweaves development, genetic, environmental, biological, and behavioral factors. Obesity is identified as a significant public health problem. Currently, approximately 17% of American kids have obesity. This disease can attack persons of all ages, and childhood obesity has been acknowledged as a global pandemic in developing nations, resulting in a host of medical conditions that lead to premature mortality and increased morbidity. One of the most common contributors to this condition throughout adolescence and childhood is the inequity in energy balance. Obesity diminishes the individual's quality of life, from respiratory and reproduction function to mood and memory. Being overweight increases the risk of developing some cancers, diabetes, high blood pressure, and heart disease. Obesity impacts the patient's self-esteem negatively, limiting their interaction with others. As a registered nurse working in a medical surgical unit providing services to bariatric patients as well as diabetics, I educate patients daily regarding weight loss and how being overweight and lack of physical inactivity as well as poor diet consumption can be attributed to causing this condition among the younger generations. As a bachelorette prepared nurse, I recognize the risks that are associated with obesity and tend to educate the individuals on the more scientific components of this condition. By explaining how obesity can result in cancer, heart disease, hypertension, and diabetes to the affected persons, the patients are better positioned to perceive the benefits of making healthier lifestyle choices. Considerably, the increase in the number of obese persons result in a surge in nursing workload by impacting the duration required to deliver care. Hence, there is a need to prevalent and increase in obesity cases, which can be effective and efficiently attained through the intervention of the nurses. Nevertheless, the fundamental prevention of being overweight avoids the development of serious secondary complexities in adulthood. Nurses may assist children and parents through availing nutritional advice via weight management programs, providing approaches for reducing caloric consumption and increasing physical exercise. Use of evidence and peer-reviewed literature to plan and implement the project. To help me find evidence-based and peer-reviewed articles for this capstone project, I utilize Capella University's online database Summon to filter peer-reviewed journal articles published only in the last 5 years. I also built upon my knowledge I gained during the duration of the project. I wanted to make sure that the research I used was relevant and credible, so I double-checked that any article were either published or updated within the last 5 years and had authors who were experts in their field. Healthcare technology to improve outcomes and communication. During my patient teachings, I was very interested to know what my patients thought would have been most helpful to their weight loss and management. One patient in particular thought it may have been beneficial if there were more check-in visits with a nurse or a doctor. He mentioned that the follow-up visits seems too inadequate and may have been the cause of him not getting the attention he needed more quickly to help aid him in his weight loss process. I explained to him what I learned in my research about telehealth visits and how meeting with patients without Having to even leave their home is a wonderful way for healthcare providers to maintain a relationship with him. He agreed that having telehealth visits would definitely be extremely helpful to him. Telemedicine is used by healthcare facilities to monitor people with obesity at home, reducing the time required for hospitalization, promoting access to consults, and availing overall better choices of quality of care. Technology is driven towards assisting with assessing, treating, and monitoring patients remotely. Off note, the most applied technology in the management of obesity is mobile phones, like text messaging and mobile applications. These applications are proliferating, and before being used by the patient, healthcare organizations or providers need to exhibit confidence in the app since it needs to be user friendly and helpful for the target or ailment. The utilization of mobile technologies tracks and improves health outcomes. Technology adoption for the management and control of this disease is critical because over the past 3 decades, the number of these obese adolescents has tripled in America. The complexities associated with obesity can be prevented when technology is fully utilized, reducing the mortality rate. Reducing the mortality rate. In addition, mobile applications and advanced technologies can be considered tools with significant potential for preventing overweight and obesity as opposed to its treatments. Considerably, this mobile application makes an individual alter their behavior in order to upload a healthy lifestyle. Of note, and individuals' literacy and the high cost of acquiring a mobile phone can act as a potential barrier to fully utilizing this application of obesity management and control. Healthy, Health policy influences. Technology in the nursing practice aids the medical practitioners to put less time on menial responsibilities and more time meeting the needs of the patient. The implementation of the required technologies increases the efficiency of healthcare providers in the treatment of identified diseases. The nursing practice standard associated with healthcare technology is the use of connected health technologies does not alter the standards of professional practice when delivering healthcare, conducting research, or providing education. ANA Core Principles 2019. In relation to the policies associated with the care, coordination is the Affordable Care Act. This policy can be linked with two benefits that are expansions to affordable insurance and restructuring of the healthcare delivery mechanism to decrease expense and improve quality. In addition, it compels nurses to uphold transformational leadership, creativity, and care coordination as fundamental stakeholders in the provision of the second generation of expense containment, patient access improvements, and quality advances. Of note, the outlined policies ensure that the nurses' practices and actions remain ethical. The ultimate goal being to improve the quality of service provided, making it patient-centered. In relation to the technology, the standard will help me concentrate on the healthcare professional's task to avail legal, high-quality, personalized, and evidence-based care despite the technique of delivery. Obesity can be attributed to causing a negative impact on the nation's economy because of the high costs involved in its management and control. Nevertheless, the treatment can be expensive for the patient to afford, and this can cause a delay in treatment, decreasing the quality of care. Project predictions and outcomes. My prediction for this patient was to be more informed about obesity and the health risks associated with it. In this case, the intervention outcomes match my prediction. He is now knowledgeable on ways on how to manage his weight and a consistent weight loss regimen. He was unaware of the many uses of technology in healthcare and plans to use them to manage his weight loss and to take better care of himself. At the end of the project, he was able to tell me ways that he was going to better manage his weight, such as changing his eating habits and committing to a healthier lifestyle, which included exercise, asking for support from his friends and family when he needs to, and making follow up visits with his doctor more often. I am pleased that this project had a positive effect on my patient. He seemed to be excited about the positive outcome. Personal and professional growth throughout the project. At the beginning of this project, I was a bit overwhelmed and not positive my research would even make a difference in contributing to any kind of lasting impact on my patient and my community. However, once I got started and met with my patient to bring new light on the subject matter, I really understood what kind of impact I could have on him and other patients that I see. I knew that my research using scholarly inquiry in Capella Summons database and other peer-reviewed journals could make a difference. I expanded on my research skills and learned how to find newer and more forward-thinking resources that contribute to overall health, specific interventions, and even technology in healthcare. I also learned so much about leadership and interdisciplinary collaboration, care coordination, and teamwork. I am much more well versed in change management theory, government and non governmental policies that affect health, and local community resources that can be extremely beneficial to my patient population. I never knew this much about how all the concepts contribute to the goal of healthcare, which is patient safety and quality of care. This program has really been beneficial to me. I am so infused with knowledge and understanding of the healthcare world and the well being of my patient. The feedback I received throughout my project served as a guide for each subsequent assessment and helped me improve my writing skills, critical thinking, and research application. Overall, I am so happy to say that this program has helped me grow tremendously as a person and as a nurse by learning more about the community I serve, and obesity specifically. I know fully that I will be a more effective nurse going forward, and I have empowered myself to make a difference in the lives of my patients. All of my instructors have been great and offered good feedback. I am grateful because it has helped me in so many ways. I plan on recommending this program to anyone who is interested in pursuing their BSN. I have also included a title page and a reference page. Again, thank you for your time.